Bipolar disorder is recognized as one of the most intricate and multifaceted mood disorders in the field of psychiatry. This disorder is characterized by significant fluctuations in an individual's emotional state, such that the affected person experiences debilitating periods of depression followed by phases of mania or hypomania. These mood swings not only impact the fabric of an individual's daily life, but also cast a shadow over various aspects of their existence, including interpersonal relationships, occupational performance, education, and even physical health. Therefore, a profound and meticulous understanding of the indicators associated with this disorder plays a crucial role in the process of accurate diagnosis, the design of effective treatment plans, and the long-term management of the illness. A thorough examination of these indicators assists mental health professionals in identifying the unique patterns of the illness in each individual, and in adopting more personalized treatment approaches. To enhance awareness and knowledge regarding this complex disorder, we will proceed with a comprehensive and detailed examination of the key and diverse indicators of various types of depression within the context of bipolar disorder, aiming to provide a clearer understanding of this condition and the challenges faced by affected individuals and their families. Severity and range of symptoms. Across the broad spectrum of bipolar disorder, the severity of symptoms in both the depressive and manic poles can vary greatly. In the depressive pole, an individual may suffer from a mild feeling of malaise and boredom, to a profound and debilitating experience of sadness, hopelessness, and a lack of motivation that prevents them from performing even the simplest daily tasks. Similarly, manic episodes can range from a state of euphoria and excessive energy, hypomania, to very severe states of mania, with risky behaviors, impaired judgment, and sometimes psychotic symptoms. This variation in the severity of symptoms necessitates the accurate diagnosis of the type of bipolar disorder and the design of appropriate treatment strategies. Duration and persistence of symptoms: acute, chronic, episodic. One of the defining characteristics of bipolar disorder is its episodic nature. Affected individuals typically experience distinct periods of depression, mania, or hypomania, each of which can last for weeks, months, or even longer. Following these episodes, an individual may enter a stable phase or a period of remission, where symptoms significantly decrease or disappear completely. However, these periods of remission are not necessarily permanent, and the likelihood of symptom recurrence in the future exists. In some cases, an individual may experience acute and severe episodes of symptoms, while in others, symptoms may persist chronically with less intensity. Understanding the temporal pattern of symptom onset is of particular importance for predicting subsequent episodes and planning preventative interventions. Temporal pattern of symptom onset: seasonal, temporary, permanent. Although bipolar disorder often manifests episodically and unpredictably, some affected individuals may exhibit specific temporal patterns in their experience of symptoms. For example, some individuals may experience a form of seasonal affective disorder, where depressive episodes occur regularly during specific times of the year, such as autumn and winter, and improve with the change of season. However, in most cases, the onset of symptoms in bipolar disorder does not follow a specific and predictable temporal pattern, and can occur temporarily in response to stressors or spontaneously. In rare cases, symptoms may persist relatively permanently with minor fluctuations, which complicates the management of the illness. Spectrum and nature of psychological symptoms. During the various phases of bipolar disorder, a wide range of psychological symptoms become apparent, differing in nature depending on the phase of the illness. In the depressive phase, an individual may experience feelings of deep and persistent sadness, loss of interest and pleasure in daily activities, anhedonia, feelings of guilt and worthlessness, reduced concentration and memory, irritability, anxiety, and in severe cases, thoughts of death and suicide. These symptoms can severely impair an individual's functioning in various areas of life. In the manic phase, conversely, the manic phase is characterized by symptoms such as an abnormally elevated level of energy and activity, an exaggerated feeling of euphoria and elation, inflated self-esteem and grandiosity, a decreased need for sleep, pressured speech and a compulsion to keep talking, racing thoughts and a flight of ideas, increased goal-directed activity such as work or academic projects, increased risky behaviors such as reckless spending, unsafe sexual practices or high-risk investments, and severe irritability. In the hypomanic phase, hypomania is a milder form of mania with similar symptoms but less intensity, and it typically does not lead to significant impairment in social or occupational functioning or require hospitalization. However, hypomania can still be indicative of bipolar disorder and requires attention and management. Accompanying physical symptoms. In addition to psychological symptoms, bipolar disorder is often accompanied by a set of physical symptoms, which are particularly prominent during depressive episodes. These symptoms can include disturbances in sleep patterns, insomnia or hypersomnia, significant changes in appetite and weight, loss or gain, a persistent feeling of fatigue and low energy, decreased energy levels, physical pains without a clear medical origin, such as headaches, back pain, or gastrointestinal issues, and psychomotor retardation, or, conversely, restlessness and agitation. These physical symptoms can significantly add to the discomfort and reduced quality of life of the affected individual. Age of onset. Bipolar disorder typically begins during adolescence or early adulthood, between 15 and 25 years of age, but this does not mean it cannot occur at other ages. In some cases, symptoms may appear for the first time in childhood or later in life. The age of onset can influence the course of the illness and the response to treatment. Earlier onset may be associated with more severe symptoms and more frequent recurrences. Underlying physical conditions. The presence of certain chronic physical illnesses can be associated with an increased risk of developing bipolar disorder or exacerbating its symptoms. For example, conditions such as diabetes, epilepsy, thyroid disorders, cardiovascular diseases, and multiple sclerosis (MS) may directly or indirectly affect mood and increase the likelihood of developing or worsening bipolar disorder. Considering these underlying conditions is very important in the diagnostic and treatment process. Presence or absence of psychotic symptoms. In severe phases of bipolar disorder, especially in mania or severe depression, psychotic symptoms may also appear. These symptoms include hallucinations, sensory perceptions in the absence of an external stimulus, such as hearing voices that are not there, delusions, false and irrational beliefs that the individual adheres to despite contradictory evidence, such as delusions of grandeur or persecution, and disorganized or unrealistic thoughts. The presence of psychotic symptoms indicates the severity of the illness and requires immediate and specialized therapeutic interventions. Mood swings, mania, or hypomania. The core of the diagnosis of bipolar disorder is the presence of distinct periods of mood swings that cycle between the poles of depression and mania or hypomania. These mood changes are usually beyond everyday mood fluctuations and are accompanied by significant changes in an individual's energy level, activity, thinking, behavior, and functioning. Identifying these patterns of mood swings, including the length of episodes, their severity, and the intervals between them, is essential for accurate diagnosis and differentiating it from other mood disorders. Response to pharmacological and psychotherapeutic treatments. The management of bipolar disorder often involves a combination of medication and psychotherapy. Mood-stabilizing medications, such as lithium, valproate, and lamotrigine, play a fundamental role in regulating mood swings and preventing the recurrence of episodes. Antidepressant medications may be prescribed during depressive episodes, but should be used with caution and under the supervision of a specialist, as they can increase the risk of developing mania or hypomania in some individuals. Psychotherapy, such as cognitive behavioral therapy, interpersonal and social rhythm therapy, and psychoeducation, also plays an important role in helping the individual understand the illness, manage symptoms, improve social and interpersonal functioning, and prevent relapse. The response to treatment can vary among individuals, and it may require adjusting medication dosages or changing therapeutic approaches. Influence of environmental stimuli and life events. Environmental factors and stressful life events can play a significant role in the onset or recurrence of bipolar disorder episodes. Events such as the loss of loved ones, emotional breakups, severe work or academic pressures, major life changes such as moving or changing jobs, and even disruptions in the circadian rhythm can act as triggers for the development of depressive or manic episodes. Identifying these triggers can help the individual and therapist develop more effective coping strategies for managing the illness and preventing relapse. Behavioral characteristics in different episodes. Mood changes in bipolar disorder are accompanied by significant changes in an individual's behavior. In the depressive phase, behaviors such as social withdrawal and isolation, decreased daily activities, psychomotor retardation and slowness, neglect of appearance and personal hygiene, and in severe cases, self-harming behaviors or suicide attempts may be observed. In the manic phase. Conversely, the manic phase is characterized by behaviors such as excessive activity and energy, pressured speech and a compulsion to talk, extravagance and excessive spending, risky and impulsive behaviors such as reckless driving, unsafe sexual practices or substance abuse, irritability and aggression, and engagement in goal-directed activities with unpleasant consequences. Cognitive changes. Bipolar disorder not only affects mood and behavior, but can also lead to cognitive changes. During depressive episodes, an individual may experience reduced concentration and attention, memory impairment, difficulty in decision-making and problem-solving, negative and self-critical thoughts, feelings of worthlessness and hopelessness, and in severe cases, thoughts of death and suicide. In the manic phase, an individual may experience racing thoughts and a flight of ideas, impaired judgment, and illogical and grandiose beliefs. These cognitive changes can significantly disrupt an individual's daily functioning. Specific symptoms of each type of depression in the context of bipolar disorder. In bipolar disorder, the type of depression an individual experiences may have its own specific characteristics. For example, in atypical depression, which is sometimes seen in the context of bipolar disorder, symptoms such as excessive sensitivity to rejection, increased appetite and weight gain, excessive sleep, and a feeling of heaviness in the arms and legs may be more prominent. Recognizing these specific symptoms can help in more accurate diagnosis, and the selection of more appropriate treatment. Presence or absence of motor symptoms. In some rare cases of severe depression, especially in the context of bipolar disorder, a type of depression called catatonic depression may occur. This condition is characterized by abnormal motor symptoms such as motor immobility, complete lack of movement and unresponsiveness to stimuli, bizarre postures, mimicking the movements of others, echopraxia, or mimicking the speech of others, echolalia. Prompt diagnosis and treatment of this condition are very important. Influence of genetic and familial factors. Research has shown that genetic factors play a significant role in the predisposition to bipolar disorder. A family history of bipolar disorder or other mood disorders, such as major depressive disorder, in first-degree relatives, parents, siblings, significantly increases an individual's likelihood of developing this disorder. Although genetics is not the sole determining factor, it plays an important role in an individual's vulnerability to the illness. Emotional and functional status after the onset of the illness. The course of bipolar disorder varies among individuals. Some individuals may achieve full recovery after each episode of the illness and remain symptom-free for extended periods. However, many individuals with this disorder experience recurrent episodes of symptoms and require ongoing management and treatment. In some cases, an individual may be resistant to typical treatments and face greater challenges in managing their illness. Understanding an individual's emotional and functional status over time is essential for planning long-term care. Symptoms concurrent with other mental disorders. Bipolar disorder often co-occurs with other mental disorders, which can complicate the diagnostic and treatment process. These comorbid disorders may include anxiety disorders, such as generalized anxiety disorder, panic disorder, obsessive-compulsive disorder, borderline personality disorder, attention deficit/hyperactivity disorder, ADHD, and substance use disorders. Diagnosing and treating these comorbid disorders simultaneously is crucial for improving the treatment outcomes of bipolar disorder. Patients' socioeconomic status. Socioeconomic factors can also influence the course and outcomes of bipolar disorder. Poverty, unemployment, lack of adequate family and social support, discrimination, and the social stigma associated with mental illness can lead to a worsening of symptoms, reduced access to appropriate treatment, and a decreased quality of life for the affected individual. Providing adequate social and economic support can play an important role in improving the situation of these individuals. How symptoms manifest and are reported by the patient and others. How symptoms manifest and are reported can play a role in the diagnosis of bipolar disorder. The patient may report symptoms directly, such as expressing feelings of sadness, hopelessness, or excessive energy, or indirectly, such as complaining of physical pains, boredom, frequent headaches, or impulsive behaviors. Additionally, observations and reports from others, family, friends, colleagues, regarding changes in the individual's mood, behavior, and functioning can provide valuable information to mental health professionals. Conclusion. Bipolar disorder is rightly recognized as a complex and multifaceted mood disorder that requires careful and comprehensive examination from various perspectives. A deep understanding of the differences and patterns in an individual's behavior, cognition, and emotions during the different phases of the illness, along with attention to underlying factors, environmental triggers, and response to treatment, helps to pave the way for more accurate diagnosis and the design of more effective treatment plans. Increasing public awareness and reducing the social stigma associated with this disorder also play a significant role in improving the quality of life of affected individuals and facilitating their access to appropriate health and treatment services. For more learning in the field of mental health, a better understanding of bipolar disorder, and modern treatment methods, be sure to join the Mental Today channel, a place for education, awareness, and psychological support.